All right, welcome to The Explainer. Today we are diving into something that, let's be honest, drives every single one of us crazy. We're talking about professional correspondence. We're going to pull straight from Module 10 of Power Prompting for Doctors to figure out how to automate all those referral letters, those consult requests, that huge amount of writing that somehow piles up after the patient is already gone home.
So let's kick things off with a number, and I guarantee if you're a clinician, you feel this one deep in your bones. 5+. That's the average number of hours we're all spending every single week just on letters, notes, and replies. And you know what that is? That's after-hours work. It's unpaid time that just fuels burnout.
And this right here, this shows you the scale of the change we're talking about. I mean, look at this. With AI as your drafting assistant, you can literally take that 5+ hours and crush it down to just 1. And listen, this isn't about cutting corners or doing less thorough work. No way! It's just about being smarter, being more efficient. It's about getting 4 hours of your life back every single week. Think about that.
Okay, so the big question is, how do we actually do this? Well, the solution, the starting point, is what the book calls the Universal Referral Letter Prompt. And I want you to think of this as more than just a template. It's like a master key, a single key that can unlock almost any door, or in our case, any piece of correspondence you need to write.
So this prompt is built in these really logical, common-sense blocks. Part 1 is all about setting the stage. You just feed the AI the basic, foundational stuff. Who's the patient, age, gender, why are you referring them, and what's the absolute must-know background history? Simple as that.
Okay, next up, you give it the clinical story. What's going on right now? What workup have you already done? The labs, the imaging, all that stuff. And what treatments have you already tried? This is so important because it gives the AI everything it needs, and it stops the specialist from having to call you back and ask, hey, did you already try this? Now, this last part. This might be the most important piece of the whole puzzle. You have to end with a crystal clear question. Don't be vague. Tell the specialist exactly what you need from them. And then, and this is a pro tip, you give the AI formatting rules. Keep it under 300 words. Use bullet points. It's a huge sign of respect for the specialist's time, and trust me, it makes your referral way more effective.
Right. So now you've got this universal key. But here's where it gets really powerful. Its real strength is that it's flexible. You can easily tweak it to fit any specific lock, any medical specialty, just by adding a couple of fields that are relevant to them.
For instance, let's say you're referring someone to cardiology for chest pain. You can tweak the prompt to add specific cardiac risk factors and then ask a super specific question, just like this one. You're not just throwing chest pain, please see, over the fence. You're actively guiding the consultation. It's a huge difference.
And the same exact idea works on the inpatient side. You can adapt the prompt for a formal consult, give a quick, high-impact summary of the hospital course, and boom, the consultant is totally up to speed in seconds.
And this is brilliant because it shows this is a two-way street. It's not just for referring out. Specialists can use the exact same kind of structure to report back. You can even tell the AI to make sure it clearly spells out who's responsible for what going forward, which, as we all know, is absolutely vital to make sure nothing falls through the cracks.
Okay, but the power of this whole system goes way beyond just referrals and consults. I mean, once you get the hang of this structured prompting idea, you start to see you can use it for pretty much any writing you have to do.
I mean, think about it. This structured approach works for everything. Those awful prior authorization appeals? Yep. A quick, informal, curbside consult email to a colleague? For sure. You can even tell the AI to switch up the tone. Make this one sound urgent. Make that one sound routine. It saves so much mental energy. So what does this actually look like in the real world, in a crazy busy practice? Let's walk through the new workflow. It's so simple, it's repeatable, and it can honestly turn a 20-minute job into something that takes less than 5 minutes.
Here's how it goes down. The second you finish a visit, right when it's all fresh in your head, you pop open your AI tool. You spend maybe 2 minutes just plugging the details into your template. The AI spits out a draft in like 30 seconds. You take 1 crucial minute to review and edit it, and then you hit send. The whole thing, about 4 minutes. It's a game changer.
Okay, now I need to be really clear about something. That 1-minute review step, it is absolutely non-negotiable. This slide right here might be the most important one of all. You have to think of yourself as the final quality control. The AI is an amazing assistant, but it is not the doctor. You are. Your clinical judgment is irreplaceable. You are always the final checkpoint.
So what does that mean?
It means before anything goes out, you run a quick mental checklist. Are the details right? Is my question super clear? Is the tone professional? And, of course, is this HIPAA compliant? At the end of the day, your name is on it, so you are 100% responsible.
Look, at the end of the day, this whole system isn't just about saving a few minutes here and there. It's about reclaiming a huge chunk of your life back from paperwork. So the real takeaway, the question I want to leave you with is this. If you really got those 4 hours back, starting next week, and then every single week after that, what would you do with them?